Yes, thank you, Mayor and City Council. Today we're going to give you a COVID-19 update, and we have several staff that are coming down. So we'll have about a 15-minute presentation, and then we'll have some time for any Q&A after that. So I'm going to turn it over to Lee Wilcox to do the introduction.
Thank you, Jennifer. Lee Wilcox, Assistant City Manager. And I'm going to let our small but mighty team get in place. Mayor and Council, it's been 4 weeks since our last report to you or update on COVID-19. Since that time, because of our local area's high vaccination rate, our own numbers continue to improve locally, while the rest of the country continues to deal with plunging numbers. Dolan will go into this in a bit. Our Emergency Operations Center, next slide, continues to support our emergency operations in the various departments, which you will hear directly from the department directors today. We continue to monitor the pandemic, national, state, local data, as well as communicate services to those most vulnerable that are still in need, given where we are with the pandemic locally. Today, you'll hear directly from Dolan Beckel around what's happening nationally at a state level, locally, from Alvin Galang around our vaccination efforts with the county, from Autumn Young around communications and outreach, Matt Kano around hybrid work in our facilities and implementing the vaccination mandate for large events, from Jackie Morales-Ferrand around our evictions and rental relief programs, Sarah Zarate around advocacy and what we're hearing from the White House around President Biden's plans, as well as John Cicerelli around childcare and food distribution, from Jill Bourne on digital equity. And we're going to continue to use this format to talk to you about what has changed since we last spoke to you, what's new, and what's driving this change as we continue to walk through this. Next slide. Before I turn it off to Dolan, I do want to say this is a summary of what we've heard at a federal and national and local level. Obviously, as you drive into work, listen to the news, this continues to change and evolve quite rapidly, daily, and in the case of CDC and FDA, sometimes hourly. So this is our best attempt to summarize what we're hearing and what's the most important as we look forward to the next few weeks. With that, I'll hand it off to our Operations Chief, Dolan Beckel.
Thanks, Lee. Good afternoon, Honorable Mayor, City Council, members of the public and city staff. Dolan Beckel here, Interim Deputy Director. Excuse me, did I say that? Interim Deputy City Manager. I'll now present the trends in COVID-19 data emphasizing the changes since our last COVID-19 update on August 17th. So since our last update, the Delta variant, the most serious variant, labeled a variant of concern, remains highly transmissible through most of the United States, as seen in the red shading here on the CDC map, and it remains the dominant variant in the United States. As shown in the orange dotted circle, pretty much in the center of the screen, the Bay Area counties are faring better with a substantial but not high transmission rate. In South America and other regions, the Mu variant, a less serious variant of interest, is being watched closely, as preliminary data indicates it is more infectious, but fortunately less transmissible than the Delta variant. The overall national vaccine rate for the United States is 75.1%, far from the 90% we need to be ensured of herd immunity and getting our way out of the coronavirus response. The good news is that the county positive cases and deaths are decreasing after a peak during COVID-19 wave 4 on August 19th. Of course, neither the city nor the county are isolated islands, and we must remain vigilant to ensure the stability of our public health system and safety of our residents and employees. One of the primary indicators of the stability of the public health system is intensive care units, or ICU, bed availability. As this graph shows, while our ICU bed availability has been relatively stable during wave 4, we remain at only 24% of the ICU beds available at the beginning of the pandemic. While the situation is currently stable, the county does not have a large contingency should there be a more serious variant arise during the winter months and thus requiring a major countywide surge again in ICU bed availability. Since our last update, both the county and the city vaccination rates continue to increase. The city's vaccination rate has moved from 85.7% on August 17th to 92.7% now, 92.5% now, or a 7% increase. The county's vaccination rate has moved from 80.3 to 88.4, or an 8% increase. Later in today's update, our EOC Vaccination Branch Director Alvin Galang will explain the city and the county's continued commitment to the ongoing vaccination drive. It should be noted this data is not inclusive of boosters, third, nor additional shots, and we will be working with the county to determine the best way to present that data. It should be noted that since we met last, we have accomplished two important things surrounding the COVID-19 data. First, I finally and recently received a point of contact with the county to engage in understanding the underlying data and taking corrective action if appropriate. And second, we just recently signed an employment agreement with one of our previous EOC data analysts who will be starting with the city shortly to help us continue our efforts in reporting clear and accurate data. As we move forward with these EOC updates, we'll endeavor to point out those areas where we are clarifying the data and are taking any action to correct the data. There were some questions at our August 17th meeting about the data on this page. We did spend quite a bit of time with the county to understanding the underlying data, and if anybody would like the painful answers during Q&A, I'm happy to answer about how we're confident in the accuracy of this data and why there are certain comparison discrepancies that arise. So, our public health efforts continue to pay off. San Jose has the highest vaccination rate in the nation, among the top 10 largest United States cities, which is probably the most important comparison given the scale and complexity of the cities. The source of this data is my eyeballs on the data on those specific websites, so I'm very confident in the data that's being presented to you here. So this concludes our presentation on the latest COVID-19 data and trends. I'll now turn the presentation back to Lee Wilcox.
I believe we are handing it off to Alvin.
Great. Thank you, Lee. Good afternoon, Honorable Mayor, City Council members, members of the public. My name is Alvin Galang, and I am the Director of the city's Vaccination Task Force from the City Manager's Office of Emergency Management. As you can see the numbers that Dolan presented, numbers-wise, we are headed in the right direction. Nearly all cities in Santa Clara County have over 90% vaccination rate of 12 and over with at least one dose. And as shown, City of San Jose is at over 92, it's actually 92.6% as of today. So it is a 0.1% incremental change, but when you take that into consideration that the City of San Jose has a population of nearly 1 million people or over 1 million people, that 0.1% accounts for 1,000 folks, right? 1,000 potential lives, 1,000 potential livelihoods that we've saved. Since July, the Vaccination Task Force has been in daily communications with the county's mobile vaccination team, working in tandem to identify locations that continue to experience lower vaccination rates. This county partnership has been strengthened by the increase and sustained supply of enough vaccine and the refocus of vaccinations from the larger mass vaccination sites to these mobile pop-up vaccination sites. Again, a more hyper-focused locations, hyper-focused clinics in these hard-to-serve areas. So I would like to take an opportunity to thank Santa Clara County Public Health Department, as well as our other providers, for their continued support and partnership. So what's driving the change? As Dolan mentioned, the Delta variant is driving the change. It started in July, it peaked in August, and now September, it is coming down. The variant may have also encouraged more people to get their vaccinations. For instance, countywide in the month of July, around 2,600 daily vaccinations were administered. By August, that number had increased to around 3,000 vaccinations, and in September, it settled back down to 2,500 vaccinations. So what we're doing is we're monitoring the decisions, the direction from federal government, from the county on booster doses, and of course, the third/additional doses as well. And so what's new? We had a mid-August peak of around 410 per 100,000, and it's currently down to under 200 per 100,000 when talking about the COVID-19 case rates. And our focused communication efforts, which will be covered more in depth by my colleague Autumn Young, and our continued dedication to serving our most vulnerable populations within the high priority census tracts. Next slide, please. What you'll see here are numbers, again, the changes since August, where nearly across the board we've increased our vaccination rates for white, Black, Latino, Latina, Latinx, and just the Asian population has had some minimal increase as well. The city of San Jose, again, is at 92.6% vaccination rate. And we've had increases in the vaccines delivered with our partners, as well as increases in the resident impressions digital vaccine outreach. Next slide, please. What you see in front of you are the 13 or the current census tracts, 13 census tracts within the city of San Jose that have lower vaccination rates. As you'll notice, and as Dolan had pointed out, there are some discrepancies with particularly Alviso. The same can also be said for the Sun neighborhoods and the Nagley Park neighborhoods, specifically with the Sun neighborhoods and the Nagley Park neighborhoods. Those are neighborhoods that kind of surround San Jose State University. And so taking into account the large number of college students that live in the area, that may also be why, again, the Sun neighborhood and Nagley Park neighborhood is listed as one of our lower vaccination rates, or lower census tracts with vaccination rates. But still, with the remaining census tracts, regardless of the Alviso, Sun, Nagley Park, bottom line is that we're not going to lose focus on making sure that we do outreach and that we do provide vaccinations to these areas within the city of San Jose. So with that, I will now let Autumn Young speak on how we're reaching our residents with vital information.
I don't think the mic. I think your mic is out.
Proud member of the Recovery Communications team. You heard Alvin talk about our remaining unvaccinated, and we understand that they're maybe not able to get or may not trust the information from mainstream platforms. So how are we reaching this group? It really requires a greater investment in relational capital. That means engaging our trusted messengers to encourage vaccination. Add that to the expiration of moratoriums and benefits. That's really driving a need to include recovery information along with our vaccination and isolation and testing information. So how are we doing that? We're working with our trusted partners, our trusted messengers, to help get the word out about vaccination and recovery. And you see some of those listed on the screen there. Specifically, we've been working with our ground team outreach from our CDBG partnerships, like Communiversity and Somos Mayfair. Other partners like Asian American Center of Santa Clara County, AXA, and Catholic Charities, to name a few. And we're also amplifying the social media of these trusted partners. Our partners at COVID-19 Black have great content, so we're able to amplify their message and get that out to the communities so that they can hear it. And our fabulous integrity partners at the San Jose Fire Department co-designed a banner, which you also see on your screen, that will go on all of our 30 fire stations, knowing that those messengers are really a valuable partner in the community. And then we've got our trusted redeploying our tactics that work, are reactivating our Spanish language radio advertising on 4 stations. We're doing a direct mail piece that actually includes recovery resources along with vaccination information out to our priority neighborhoods. And as Alvin mentioned, the county has really ramped up their hyper-focused clinic, which you can see by the image on the right that is one slide for 2 days of vaccination clinic opportunities that we are creating those slides, and then in concert, the county is creating social media and flyers that we're able to get out to the community, which is a really great benefit. We didn't have that resource before, and that takes the load off of our team. Slide 2, please. Next slide. Great. WIA works. The WIA, the Wireless Emergency Alert System, we send out in Spanish and English to our hardest to reach residents, and we believe these are actually residents that wouldn't get the message otherwise, and it works to get vaccine doses in arms. You can see the quote from Sue Ellen Haggerty of the Santa Clara County Public Health Department. She said, "As part of my role in observation, I asked almost every patient how they heard about the clinic. With 3 exceptions, and this was 158 vaccinations, with 3 exceptions, everyone else said they got the text alert on their phone. So we're here saying that nearly 100% of the patients were directed to their vaccine by the text alert. We believe the text alert was integral to the successful turnout and also for the clinic at El Viso, exclamation point, exclamation point, exclamation point, exclamation point. Thanks for your leadership in our community." And this is a great tactic, but we really have to use balance when we are using this. We know that these alerts turn out the residents, but it also comes with some concerns about oversaturation and making sure that we aren't over-broadcasting. There is a small glitch in the system that doesn't allow us to hyper-focus as much as we can, so it goes out to a wider group. And because of that, we've used these guidelines for selecting the clinics to promote. We plan our WIA broadcasts about 7 days apart. We select locations that serve the highest priority census tracts and neighborhoods. And within those highest priority census tracts and neighborhoods, we make sure to consider equitable implementation across council districts. We've deployed 11 notifications to date. The next one up is this Saturday for an event on Sunday at the Horace Curitan School in District 5. The text alert has another great benefit, and that is that it drives recipients to the City of San Jose emergency notification webpage, where visitors also get additional recovery support information along with the vaccine clinic details in the language they prefer. An example of that, you see on the screen a snapshot of the safety alert. You've got a small piece in Spanish and then the English longer alert. On the day that went out, we had over 5,200 recipients click the English page. Now that's 10 times the usual traffic of our webpage. And then more than 1,500 clicked to the Spanish language page. Close to 200 visitors went to the Vietnamese and Chinese page, which is significant because users actually have to take an additional step to select that language. So WIA works, and we are really proud to be able to use that to get shots in arms. So in closing, the recovery communications team is continuing to message vaccination and testing and isolation services and is ready to support what's next for amplifying additional recovery resources, boosters and third doses, as well as the under 12 age group when approved. Thank you. Now I'll pass it over to Matt Cano, who will present about city facilities.
Thank you, Autumn. Matt Cano, Director of Public Works. I have a brief presentation on hybrid work facilities and resources. What has changed? So we have, for employees who can effectively perform their work from home, we have delayed bringing those employees back to the in-person office work until November 1st. We have, as you're aware, adopted and implemented a vaccination ordinance for events of 50 or more people in city-owned facilities, and that took effect on September 20th. Those changes are being driven by the increasing cases and risk of COVID due to the Delta virus and prioritizing the safety of our community. A few new things to mention. The EOC had moved the activation up from level 4, which was monitoring, to level 3 as the Delta variant continued to impact our area. And as you are aware, we're sitting today in a hybrid meeting that is in person and on Zoom for city council meetings. However, due to some staffing vacancies and lack of staffing and equipment, we are holding off on having hybrid meetings for committees and commissions until a future date. And we'll be able to report more on that as time goes by, and happy to answer any questions on this later during the discussion. And I'll turn it over to Jackie now for the next part of the update.
Thank you, Matt. I'm Jackie Morales-Farand, and I am the Director of Housing, and I'm here to discuss both the eviction and rental relief response. So in terms of what has changed, the state eviction moratorium under AB 832 is going to be ending at the end of this month. And what that means for our tenants is that they are going to have to pay full rent beginning October 1st. AB 832 does provide some additional protections that continue through March 2022, and the staff will be providing a more detailed report later on in this agenda. And one of the biggest changes, of course, that came with AB 832 is that it does prevent the city or county from taking any further action when it comes regarding eviction protections until April 1st of 2022. We continue to implement our rental relief program, and you can see from the slide the number of different outreach programs we've been working on over the past couple of months. In terms of an update, locally we've received 5,800 applications with $65 million worth of funds requested from both the city and county because it's a combined program. We've paid over close to half of those requests, distributing close to $25 million. From the state applications, I can draw down the city of San Jose only, and they have received a little over 5,000 applications, which they have funded a little over 2,000. Their funds requested just from the city of San Jose is over $67 million, and they've paid over $26 million. And so they've spent close to 100% of our ERA funds. And as you know, we are working on moving our ERA 2 funds to the state. And with that, I'll be available for questions, and I'm turning it over to Sarah.
For their interim recess and will reconvene in January 2022. We did not see statewide vaccine mandate legislation move forward this year. And as mentioned by our housing team, unfortunately, no additional legislation was put forward or executive order issued to extend the eviction moratorium that expires on September 30th. The city led extensive advocacy to amend the state's Brown Act laws to allow exceptions for immunocompromised members of boards and commissions. Thank you again to the council members for submitting letters advocating for legislative amendments. Although our proposed amendments were not accepted, our concerns were heard loud and clear by the governor's office and Assemblymember Rivas, who added an urgency clause to AB 361. This bill was signed by the governor and allows remote meetings to continue under an emergency declaration. Our city clerk also authored a memo on this item if you're interested in further details. Additionally, we continue to monitor the implementation of the White House Path Out of the Pandemic Action Plan and any related federal action. At this time, we have no further updates on implementation beyond the booster updates you heard from Alvin. On the budget front, California released draft guidelines for financial assistance to residents and businesses for past due water and electricity bills. We anticipate funding availability this winter. The governor also signed Omnibus Budget Bill SB 155, providing an extension on the moratorium for water service disconnections. No disconnections can be done for non-payment until after December 31st, 2021. Lastly, recommended adjustments to the Community and Economic Recovery budget will be considered at the November 2nd City Council meeting. Additional information on utility arrearage programs will also be provided at the November Council meeting. And with that, I'll turn it over to John and Jill.
Thank you. Good afternoon. John Cicerelli, Director of Parks, Recreation, Neighborhood Services. I'm going to do a quick update on food distribution and childcare. In August, we provided 8.75 million meals to our community. About half of those were by Second Harvest. We are seeing inflation impact the cost of food, water, milk, gas. So that is driving some cost for us. We are extending contracts with our current providers under some authority we already have from the council previously through the end of this calendar year. It's likely we'll be back to extend that even further as part of the November 2nd meeting we're going to have about extending into the first quarter of the next year. So that would be January through March. That's expected to be around $1.2 million, sorry. We are monitoring the insecurity. Obviously, we know that insecurity goes up around the holidays. That's a concern for us, so that's part of why we're extending the current contracts. That wasn't the original plan, but we want to be ready for the uncertainty and really just get through the holidays. As Dolan will tell you, everything kind of went sideways last year, starting with about Halloween and then the holidays, and so we locked back down, if you all recall. So we're going to take a wait-and-see approach and try to be prepared to be reactive if something goes sideways again this year. Of course, we're hopeful that it won't. But otherwise, food is relatively stable right now. On childcare front, we had over 250 youth that benefited from our community development block grants to the tune of over $500,000 of support. We began 31 after-school programs in mid-August, transitioning from summer camps into schools. We're serving now a little over 1,100 youth on a daily basis. We are struggling a little bit with, obviously in these age categories, these are kids from kindergarten through 6th primarily. So these are unvaccinated individuals that our staff are interacting with. So sometimes people are getting exposed. We are seeing some positive cases either in the kids or in their families or even the teachers. And then the kids that were in the teacher's class got exposed. We have some trouble with the schools sharing health information with minors, as you can imagine. So we're creating a parental consent form to ask the parents, just give us permission that if something comes up, the school can talk to us about it. Because what we've done is we started to break we might have 30 kids in an after-school program or more. So we're trying to keep them a little isolated into smaller groups so that if one of those kids was exposed, only a portion of the larger group has to quarantine or be affected. The rest of the group, we're keeping 6 feet or more away so the exposure isn't the same. So that's one of the things we're trying to do to sort of mitigate so that we're not shutting down full classes. We did manage to get our teen centers open, so we're serving a little under 200 teens a day, so we're happy to see those kids not on the street for at least some hours of the day. We also, of course, got recreation preschool going. We got 16 classes over 12 locations. We'll do 58 throughout the year. That's in person. And last but not least, of course, we're pursuing a variety of funding sources, both state and federal, both with our friends at IGR, but also through the County Office of Education, who we meet with frequently. I'll pass this on to our city librarian.
Good afternoon, Mayor and Council. Jill Warren, City Librarian and lead on the digital equity team. I'm happy to report that all work streams are moving forward as planned. The community Wi-Fi projects are all progressing on schedule. Construction will start at the Independence High School attendance area in November. We also have 1,200 new library hotspots that have been ordered, expected arrival and circulation starting in early October. Our school hotspot partnership is providing 3,820 hotspots to start the school year and will be expanding to 6,100 hotspots through the Emergency Connectivity Fund if awarded. And finally, Chromebooks, iPads, hotspots, and other devices are continued limited availability through our San Jose Public Library branches, but this collection is growing all the time. I just wanted to note that we do have a detailed report on digital inclusion and equity activities coming to both the Smart Cities and the Neighborhood Services and Education Committees within the next month. And I'll pass it to Jackie.
From the start of the pandemic through September 24th, the isolation and quarantine program has helped nearly 1,914 persons, including persons without a permanent home, to isolate or quarantine in hotels. In addition, we've provided supportive services and a little over $1 million in groceries and other necessities to help the close to 5,200 households to meet their needs. We've also distributed close to $9.5 million in direct rental and financial assistance to 4,472 households. 90% of the people who've been helped in this program are residents of San Jose. We're working with the county, who has requested additional funding until the end of this year in order to continue to offer these services. All of the county isolation and quarantine staff have been trained to provide assistance on our rental assistance program, including application assistance to residents who are contacted through the hotline. The county is also meeting with colleges, including San Jose State, to provide public health protocols and isolation and quarantine resources for their students and staff. So we continue to work to expand the program and to provide additional services as the pandemic continues. And with that, I'm turning it over to Lee.
Thank you, Jackie, and thank you, Mayor and Council and Public. That concludes our presentation. We're available for questions.